Okay, for the sake of time, let us directly continue. My name is Kai Brickmann. I am also from AstraZeneca. You met my colleague Orsa already during the panel session here. So both of us will now give a short presentation about AstraZeneca. We have planned for 15 minutes. I will plan to talk about 5-6 minutes just about some corporate information about AstraZeneca, and then also will be a little bit more specific about our partnering activities in the Nordics. So to say we are both members of AstraZeneca's business development teams and are both located at AstraZeneca Gothenburg. Let me just see. This here should move now.
I might have turned off.
Yeah. There you go. Okay, thank you very much. Okay, and in AstraZeneca's ambition to follow the science and really being close to breakthrough science all the time, we have located our 3 major research centers close to bioscience clusters. So we have our research site in Gaithersburg in the US, which is close to the National Institute of Health. We have Cambridge, close to the university and the biotech company community there. And then, of course, Gothenburg, which is connection to Karolinska and also to Medicon village here in Lund. Always when I talk in Sweden about AstraZeneca, I cannot resist to say a little bit more about AstraZeneca and Gothenburg. As I said, Gothenburg is one of our major research sites. We have around 2,500 people working there. We are supporting all of our core therapeutic areas. And it is a fantastic site. And please allow me some personal reflections, because I have been at this site now for more than 21 years, and I am still excited to come to work there every day, because it is one of the sites where we really have capabilities to support all stages of AstraZeneca's medicines. So you really find experts there that know everything about target identification, but you can also easily walk out to the corridor and find colleagues that really are able to support you in how to design a phase 3 clinical trial. Some global dimensions of AstraZeneca. We are a global pharmaceutical company. We are almost 65,000 employees all over the world. Our product sales in last year were 21.1 billion, and that was up 4%. And I think those of you who have followed AstraZeneca during recent years, we had really, I think, an ambition to return to growth. And I think we have seen this, I think, last year, and that actually continued this year. I think those of you that follow the news, I think, have probably seen our report for the first 9 months this year, and sales are up 13%. So really, I think, a great company to be in. I think we still also make some revenue from externalization, and this is because we really want to focus our R&D money that we spend every year. It's almost $6 billion on our core therapeutic areas. Core therapeutic areas, oncology, cardiovascular, renal and metabolism, and also respiratory. These are the areas where we really focus on. As Åsa mentioned, a few years ago, when you came to AstraZeneca, let us say when I started at AstraZeneca, which is now more than 20 years ago, you came to a site working on small molecules, quite a closed community. Now you come to AstraZeneca, we have capabilities in small molecules, biologics, we work with protein engineering, we focus on devices, diagnostics, and quite a lot also in new modalities. And I had the privilege to be one of AstraZeneca's deal makers during these recent years, where we really moved from small molecules to other modalities. So I had been working on the deal with Moderna to get modified RNAs into the portfolio. I worked with Ionis Pharmaceuticals to get antisense oligos into the portfolio. And I'm also very happy that I did a deal in Sweden quite recently with Procella, which started actually AstraZeneca's activities towards cell therapy. High-level business development slide. I think you see some of the partnerships that we did recently. I don't want to go through this. Just to mention, as many big pharma companies, we are, of course, considering different types of deal activities. We can do in-licensings, we can do acquisitions, we also do externalizations, and also divestments when we think a partner is better suited to commercialize an AstraZeneca product that is no longer within our core interest. And I think there's a very good example of a deal that also closed very recently, I think where the rights of Losec, omeprazole, were divested to a German company. This is actually a good opportunity to hand over to Åsa, so please continue.
Thank you, Kai. Yeah, so what Kai just mentioned, the divestment of Losec, that was once our big blockbuster, and that was invented by the scientist in Mölndal, so it was clearly an invented here product. Since then, our strategy with respect to externalization has changed significantly, and we do realize that innovation doesn't happen in isolation any longer. And as I mentioned slightly before, was that we believe that innovation is what drives our growth. And so therefore, partnering in all its different forms, as Kai just described, is really one of our basic pillars to drive our efforts to have an efficient business, but also to help patients with their needs. But in addition, I also want to highlight we have some other initiatives to help support the life science community as a whole. And so, for instance, the open innovation where we provide access to tool compounds, even clinically ready compounds, libraries, screening technologies, and so forth. And within the Nordics, we are working with a business mentoring initiative where we work with startups which are associated with incubators and other innovation clusters. You probably have heard of the BioVenture Hub, and there's now also a new initiative where we're looking to create something similar to Medicon Village, the GoCo Health Innovation City. Due to the limited time, I won't be able to go through all of these different initiatives, but I will focus on what might be interesting for you if you want to partner with AstraZeneca. So, if you are interested in getting in contact with us, please do, preferably early, and you can do that multiple times if needed. And I already touched upon the 5 R's, which we use to assess projects, both internally and external opportunities. And when presenting your data, it's just highly recommended to be open if there are any gaps or any potential issues. Because if we do proceed in an interaction with you, we will have a due diligence, and the scientists will find these spots anyway. And of course, that will not be that positive far down the line to realize that you might have said that there are no issues whatsoever, and we end up. While on the other hand, if we take them up front, we could probably mitigate them and see if there's a solution around it. And so just as it is important to be open and transparent, also be very clear about what value you could add to AstraZeneca, but also if you have an idea of what value that we could add to your opportunity and also to your company. And should it be found that your opportunity is not maybe the optimal one at this moment, don't hesitate to come back if you have generated new data or new information. So this I already touched upon, so I will skip quickly over this as there's sort of limited time to this presentation. So some other tips regarding negotiation. If you want to strike a win-win deal and set a good platform for the future collaboration and interaction, we would like to you to focus on building that relationship and get trust between the companies. And just as much as we would prefer you to be clear, open, and honest with your major needs and potential major issues, we would do the same. And by doing that, it's so much easier to come up with a flexible and more innovative solution to come around those potential hurdles that might be there. So in essence, do trust that the partner that you are negotiating with also wants to strike that positive win-win deal. And then just another housekeeping thing to think about is to do ensure that you have your management insight and access to key decision makers, because nobody wants to do a long negotiation and then find out that what you thought you actually had agreed upon indeed wasn't agreed upon. And then just a few words on these other initiatives that we are working with to try to support the innovation climate here in the Nordics. We do not only want to talk to those of you that are having opportunities in the partnering stage, but also to the startups that are associated with incubators and other innovation clusters, and see if we can help then with strategic, non-confidential questions. So how it works is that we would then align these companies with our mentors and then be able to provide the big pharma view on these strategic questions and just provide advice or challenge or whatever might be needed or wished by these startup companies. On the other hand, the AstraZeneca employees get the opportunity to meet with you innovative entrepreneurs and increasing their network and seeing interesting science. And I want to also emphasize that this is a complement to the existing incubator coaching and consultants that are out there. And we have done this now for a year or so, and we are looking for feedback both from these external companies but also from their mentors, and everybody seemed to think that this is a mutually beneficial activity that we are doing. So if you know those that might be interested, please mention this initiative. And then we do have the BioVenture Hub, which was established by AstraZeneca in 2014. It's located, as you can see, right in the middle of our facilities in Mölndal. At the moment, we have 28 different companies in there that can share expertise, network among themselves, but also network with the employees of AstraZeneca. And I want to also highlight that there is one company here today on doses that is located there, and I encourage you to stay to listen to the following panel discussion where Kai and Martin will talk about how they struck that deal and how we are collaborating together. Yes, I see I actually do have more time than I thought since I skipped over that slide there. So this was just a very brief introduction, obviously, to our partnering and our externalization activities. And if you want more information, I also encourage you to look at our website. And if you have any direct questions regarding partnering, please reach out to myself or to Kai. If you're interested in the BioVenture Hub, then please contact Magnus Björsne. And I thank you for your attention.